The following podcast is taken from a live broadcast on Inspire FM.
Any health advice given, whether general, diet, physical or spiritual, is general only and must be verified by your doctor. If you need medical advice, please consult a doctor.
Assalamu alaikum to all our listeners and viewers. I welcome you all to another exciting and educating edition of the Health and Fitness Show. I'm Fahad Matin, your host for today, and I hope and pray that all of us are fit and healthy by the grace of Almighty Allah. I do pray that we all had a nice and positive week so far, and looking forward for a nice and relaxing weekend. And I hope that everybody enjoyed snow. Yes, indeed, it was snowing this morning, and I must say I really enjoyed my driving back to work during the snow time. And surprisingly, there was people driving very sensibly rather than hooligans. So I really enjoyed my drive back. Drive up. Anyhow, that's all for my personal side. For today's show, this program is broadcasting live from the studios of Inspire FM today on 27th of February 2020, and casting its positive vibes to all our lovely people in Luton. And all the surrounding areas of Luton, like Dunstable, Harpeth and Bedford. And our positive airways reaching all our listeners who are listening us via Inspire FM app or website. You can also view us on Facebook. All you have to do is just go to Inspire FM Facebook page and click the live link. If you're listening to the show on Sunday or any other Thursday, that means it's repeat. But today is 27th of February, that means it is live. As we all know, we cover different health informative topics every single week. On today's topic is pretty much on the same line in many different ways. So normally I say a positive quote, but today I'm not saying any positive quotes because I thought today's topic deserves a bit kind of a uniqueness in its own way. So the topic which we are discussing today is a very sensitive topic in a way. No, it's not coronavirus, because yes, that is a sensitive topic. We are talking about another one, which is shingles. Yes, indeed, we are talking about shingles, and shingles is one of those problems which people normally have different ages. And I am not the one who will be talking about this. Alhamdulillah, I do have a guest with me. Yes, indeed, I have a very lovely guest with me who will be explaining us about shingles. And instead of me giving a brief introduction about herself, why don't I let her give a quick introduction about herself? So, my guest today is...
Hi, so I'm Harriet Edmondson. Thank you very much for having me on the show. It's a pleasure to be here.
It's our pleasure, Harriet. How are you today?
I'm very well, thank you.
So, Harriet, tell us about yourself. You're a doctor.
Yes, that's right. So I'm a public health registrar. So I trained in medicine, worked as a junior doctor for a couple of years, and then joined the public health specialty training program to become a public health consultant eventually.
Mm-hmm. And since you joined public health, how things are?
Very good. I'm enjoying it. Getting lots of different experience.
Good.
Yeah.
Good, because sometimes when you start a new line of work, especially what you're doing regularly, it's always hard, and it's one of those things which you. When you join up, it's hard, isn't it?
Yeah, it's quite a change from clinical medicine, working in the hospitals and that sort of thing, yeah.
Okay, but at the same time, let me introduce our guest as well, so listeners as well. So listeners, If you have any questions or queries regarding our topic today, which is shingles, please do get in touch with us. If you want to get in touch with us, all you have to do is call us on 01582 481822. I repeat, 01582 481822. Or you can send your questions via text messages or WhatsApp on 07779 481822. I repeat, 07779 481822. So, Harriet, as we are talking about shingles, let's start by asking, what is shingles? So, for people who do not know anything about it, what do you say what shingles are?
Well, what I would say is shingles is a viral infection, and it's an infection of the nerve cells and the surrounding skin. It's also sometimes called herpes zoster. You might hear that term used as well.
Herpes zoster?
Yeah, that's just you might hear
that's
some...
a very unique name, I must say.
Yeah. So essentially it causes a painful skin rash, and it's caused by the chickenpox virus. So some of your listeners might have experienced it themselves or might know relatives or friends who've had it. It causes a kind of rash of painful, itchy blisters on one side of the body, usually on the chest or the tummy, but it can also affect the face or even the eye. It can be very painful. People who experience it often say it's interrupts their normal daily life, and it's something that becomes more common as you get older as well.
So that means it can any age can it can affect at any age.
So anyone who's had chickenpox can get shingles. It does tend to be much more common in older people, so particularly in people aged over 70 years old. But it is possible to have it at any stage after you've had chickenpox.
Okay, so in terms of the seriousness, how long does it last, and how is it really serious? Is it that serious?
Well, perhaps if I just talk you through the kind of course of how it normally runs. So normally people will get a bit of general symptoms first, feel a bit unwell, might get a bit of pain or tingling. A few days later, they'll start to get these blisters on one side of the body, which are quite painful, itchy. Those last for usually about 7 days, 10 days, and then they start to heal and crust over, but it can take sort of about a month for the rash to completely clear up. The pain that comes with the rash can actually last longer than the rash, and that can last up to about 6 weeks, although it does settle in most people. But as you said, shingles can be serious. So in most people it does settle down, but the older you are, the more likely you are not only to have shingles, but also to have it more severely, and for it to last longer and to have some complications. So that ongoing pain, if it lasts more than about 3 months, then we give it a very kind of clinical term, which is post-herpetic neuralgia. And what that just means is nerve-type pain going on after you've had this shingles virus. And that can be a really unpleasant condition for people. It can be very painful. It's this kind of nerve-type pain, which can feel like a burning sensation or a sort of stabbing sensation. And that can be quite difficult to manage. And very occasionally people can be hospitalised because of shingles, and very, very rarely unfortunately people can pass away from complications from shingles, but that's very, very rare.
Really?
Yeah.
Wow, okay. Yeah, because I know a few people who had shingles, and they've been hospitalised as well, and they have gone through painful situations. I have friends, I have family members who have been infected as well with shingles. So I know it's one of those things. Alhamdulillah, personally have not got it yet, but then who knows? Yeah. It's one of those things. In terms of the causes of shingles, I know everything has its cause in its way. So what caused shingles, to be honest?
So shingles is caused by the same virus as chickenpox, and that virus, people in the UK, generally, most people will have chickenpox during childhood, so that by the time we become an adult, nearly everyone has had it. And that might be, for some people, it's very mild. They might not even know they had it, but most people do have it. after you have chickenpox, that virus actually stays in your body for the rest of your life. It kind of goes and it becomes inactive. It sort of goes to sleep in your nerve cells, kept under control by your immune system. Then later in life, your immune system might become weaker as you get older, or it might become weaker for other reasons, stress, or if you have another condition, or you take some particular medication. And when that happens, that can allow the virus to wake up and to cause the shingles. So that's the,
Okay, let me involve our listeners as well. Listeners, if you have any questions or queries regarding our topic today, which is shingles, please do get in touch with us. If you or any of your loved ones been infected, and if you have or been infected in past, and if you have any experience you'd like to share, please do give us a call on 01582 481822, or you can send your comments or your questions via text messages or WhatsApp on 07779 481822. I repeat, 07779 481822. So, Harriet, in terms of shingles, one of the things people always worried about is that with any disease, how much they can catch it, means how quick they can get infected. So, is shingles easy to catch something?
Something that you can't catch. So you can't catch shingles from someone else who has shingles or from someone who has chickenpox. And the reason is because, as we were sort of discussing before, shingles really describes that chickenpox virus you already have from when you caught chickenpox when you were younger, that waking up. So it's that you already had that virus there. It's not that you caught it. People who have shingles can be infectious themselves, can pass on that virus, but it's much less infectious than chickenpox. I mean, everyone knows chickenpox is something that is very, very infectious, catch it a lot in younger children. Shingles is a bit different. When you have those blisters, you can pass on that virus. It's only really a worry if the person has never had chickenpox before, and they can then get chickenpox from your shingles. But it's quite low risk. If you have shingles and you keep the blisters covered up, that reduces the risk even more. And you're only infectious whilst you have those blisters. Once they've dried up, then you don't need to worry anymore.
Okay, so in terms of, because with chickenpox, when it says that when you are pregnant, chickenpox is something you have to keep the person who has chickenpox away from pregnant ladies because it has own complications. Yes. Is it similar with shingles as well?
It's advisable that if you have shingles, you should avoid contact with people who are a bit more vulnerable to getting chickenpox, including pregnant women, just during that time that you have those blisters. So yeah, it's similar in that sense.
Okay, so I need to touch base on that a bit more, but let's talk about treatment, because whenever something like these normally happen, we always want to know, is it treatable or not?
Of course.
And when we talk about shingles, how shingles get treated? Can shingles? Firstly, let me ask: can shingles get treated?
So there are treatments available to help manage shingles. Won't get rid of the virus, but shingles, there are antiviral treatments that if you give them in the first 3 days that you have the rash, that can help to shorten the illness and to help reduce the risk of any complications from the illness. So it's really more about that episode and helping it to not be as serious. But shingles, in that respect, can be difficult to manage, and particularly the complications like long-lasting pain can be quite difficult to manage. What I would say is, if people think that they might have shingles, just because it's so important to get that early treatment, try and, as soon as you think that you might have shingles, get in touch with your GP or call 111 for some advice about that.
So, in terms of the early signs and symptoms for shingles, now everybody knows that what chickenpox signs are, because before chickenpox comes up, you have very awkward rashes according different parts of the body, and it just carries on and on and on and on, and you say, why am I having so much that kind of a scratchiness throughout the body and itchiness throughout the body. So is there any signs and symptoms for shingles as well before coming on? And is there any, how do a common person, a Joe Blogger from the road, can understand whether it is shingle or it is something else?
Well, I think it's quite difficult to recognise shingles before you really get the rash, because you just have this quite non-specific feeling of being a bit unwell, maybe a headache. You might recognise some kind of pain or tingling in just one area of skin on your body, and that might be a clue, but it's quite difficult if you've not had shingles before, perhaps, to recognise that that's what it is. When the rash starts to come, I think it's quite distinctive because it tends to just be on one side of your body, so sort of from the middle of your body across to one side, just because of the way it affects particular nerves, and it tends to kind of be in a sort of band or ring around the body from the middle round to the middle at the back as well. So that's quite distinctive, as are the blisters that you get, sort of fluid-filled blisters, which are similar to chickenpox, although tend to be a bit bigger than you get in chickenpox as well.
Okay. So, and is it easily recognizable? So when people see it, can they easily spot it?
So I think if you went to see your GP, because it's so common as well and distinctive, I think they would be quite easily recognisable if it has that typical kind of presentation.
Okay. So as we go along, and when we talk about treatment, we always talk about protection as well. And when there's talk about protection, we always want to know if we can protect ourselves and our loved ones with something like that. And especially if one of our loved ones been infected, like for example mother, father, or grandmoms, granddads, we don't want our kids or any other siblings to be infected as well. So how can we protect ourselves, or what can we do to protect ourselves from shingles?
Well, I think that one of the most important things is that there is a vaccine available for shingles, and that has been part of the a national programme since 2013, which is when it first started. So this vaccine helps to reduce your risk of getting shingles. It also if you do still go on to get shingles even after having had the vaccine, then it reduces the severity of the illness that you have and reduces the risk of complications, and of how long, and sort of shortens the illness. So that vaccine is available for everyone aged between 70 and 79, so right up till until your 80th birthday. And if you're in that age group, even if you missed it previously, then you can still have it at any stage up until you become 80. And that vaccine, when you're eligible for it, you can have it at any time of year. Your GP will probably invite you when you turn 70, but don't worry if you've missed it, you can still ask for it at any stage. And that vaccine is offered to that age group because that is the age group in which it is much more common, over 70-year-olds, and in who it is more severe when you do get shingles as well. So that's the reason why it's offered to that age group. And that vaccine, that will significantly reduce your risk of developing shingles. It's not a guarantee that you 100% won't get shingles, but it does substantially reduce the risk. And as I said before, even if you do go on to get shingles, having had the vaccine is still a good thing because it makes it milder and lasts less time. So that's one of the most important things. What I would also say is there might be some people listening who are thinking, oh, I've already had shingles, so I don't need the vaccine. But actually would recommend you still have it even if you've had shingles. Unfortunately, some people do get shingles more than once, even though this is less common. And having the vaccine, that will just boost your immunity and help to reduce the chance of getting shingles again in the future, which I'm sure people would be keen to avoid.
Okay, in terms of, let me involve the listeners as well. So listeners, If you have any questions or queries regarding our topic today, which is shingles, please do give us a call on 01582 481822. If you've been infected, or if one of your loved ones been infected, or if you have any interaction with the disease, or the people who have gone through shingles, and you have any comments to make or any observation which you'd like to highlight, please either call us on 01582 481822, or you can send your comments and your questions via text messages or WhatsApp on 07779 481822. I repeat, 07779 481822. I think so. I have I have a question and a comment. Interesting topic. Thank you so much for highlighting it. I'd just like to ask, are there any side effects of the vaccine?
Well, yes, that's a great question. I think most vaccines do have some side effects. For this vaccine, the side effects are usually, for most people who have them, quite mild, and they don't last very long. The most common side effects that people will report, so about roughly 1 in 10 people who have the vaccine will say that where they had the injection at the site, they've had some redness or a bit of pain, some swelling or bruising, something like that. Other relatively common side effects are things like having a headache afterwards, feeling generally unwell. All of these side effects should not last more than a few days. Having more severe side effects are very uncommon, and it's very rare to have a rash that develops as a result of the vaccine. What we would advise is that if you do have the vaccination and you do have side effects that last longer than a few days, or you get a rash, that you should see your GP about that. But it's very rare to have a kind of chickenpox-like illness as a result from having the vaccine. Like all vaccines, this one has been thoroughly tested. It meets all of the UK safety requirements, and it's been used very extensively now in the UK since the start of the programme in 2013. And in other countries across the world as well.
Wow. Okay. So in terms of the vaccine itself, so if you are infected, or if you are going through the time when you have shingles, can a person have vaccine at that time as well, or is it not?
So we wouldn't recommend that you have the vaccine when you actually have shingles. The vaccine, it doesn't treat the shingles that you have. It won't help with that. And we would recommend, in general, it's recommended that people don't come for vaccines when they're acutely unwell anyway. So what we would say is to not have the vaccine when you've got shingles, to wait, see your GP afterwards, but then after a suitable time interval, often we say about a year, you can then have the vaccine to reduce the chances of having shingles again in the future.
So if you are infected with shingles, what do we need to do?
So if you suspect you have shingles, then get in touch with your GP, let them know that you think that you have shingles, and then they can see you and decide whether you might benefit from having some antiviral treatment to try and help with that episode and try and reduce the risk of it becoming a long-lasting episode or having any complications. If you're in terms of things you can do at home, you can take paracetamol for general pain relief, try and keep the rash clean and dry to reduce the risk of infection, loose clothes, that sort of thing. And some people find some relief from using a cool compress, so a bag of frozen peas wrapped in a towel or something like that, just to relieve the kind of symptoms on the skin.
So technically speaking, when if you are unfortunate enough and you somehow get infected with shingles, all you have to do is just do the same thing which you do it in chickenpox, which is wait and try to calm your nerves down.
That's sensible advice.
Yes, indeed, and definitely get in touch with your GP. So a person can go to GP surgeries, can they? It's not necessary a person should isolate themselves inside the house or safeguard themselves or something like that.
Well, with shingles, a lot of the issue, the infectiousness is from someone being directly in contact with those blisters. So the risk of of sort of spreading it is much lower than with chickenpox, and it's much reduced if you can cover that rash. What I would say is, in the first instance, give 111 a call or your GP surgery and describe the symptoms you have, and just check that they're happy for you to come in for an appointment.
Mm-hmm. Okay, and when you said cover the area, infected area, that means cover with the plaster or bandage, or is it just cover with clothes?
So as long as you can sort of use kind of dressings if you need to be, or just have loose fitting clothing over the area. So it's obviously more difficult to keep covered, for instance, if someone has on their face or has a more extensive rash.
Okay.
Yeah.
Okay. Unfortunately, we are about to go for a very quick short break. When we come back from the break, we will talk a bit more about shingles, and we will find out what people think about it, and what should we do if we can't have vaccine and so forth. So and definitely we have a doctor in the house. So if you have any questions or queries regarding shingles, so please do get in touch with us. But this and many more will come on the other side of the break. So when we come back from the break, we will be finding out where is the vaccines been given, and how you can get your hand on these vaccines, and what can be done if you are treating shingles. So this and many more just after these very short messages.
Assalamu alaikum, this is Atif Nawaz. Listen to Inspire FM shows in your time by heading over to inspirefm.org, or listen on Apple Podcasts or Spotify.
Any health advice given, whether general, diet, physical or spiritual, is general only and must be verified by your doctor. If you need medical advice, please consult a doctor.
Assalamu alaikum and good evening to all our listeners and viewers. Welcome back to the Health and Fitness Show. I'm your host Fahad Matin for today's evening, and we are talking about shingles with our lovely guest Dr Harriet Edmondson from Public Health England. Good evening, Doc.
Good evening.
How are you today?
Fine, thank you.
It's our doctor's debut performance on any of the radio shows, so we are very lucky to have her on our radio show for the very first time in her debut role, because she has never been to any show, isn't it?
Yes, that's right. I've never been on the radio before.
Perfect. This program is broadcasting live today on 27th of February 2020 and from the studios of Inspire FM. For lovely people in Luton and all the surrounding areas of Luton like Dunstable, Harpenden and Bedford. When I said Bedford, I mean Bedfordshire. And definitely reaching all our listeners who are listening us using Inspire FM app or website, or you can listen us or view us via Facebook page. All you have to do is go to Inspire FM Facebook page and click the live link. So before we went on break, we were talking about shingles in many different ways, and we want to know about different treatment. And definitely, if you have any burning questions and queries regarding shingles, or if yourself or any of your loved one been infected with shingles in any time frame, please do get in touch with us, share your experience with us and your thoughts as in what did happen at that time, because patient counts are always important, and definitely sometimes it's always nice to give your own experience as well what does happen, but definitely we have a doctor in the house, so if we have any questions or queries, we will definitely ask her and please do ask her. So, Doc, good evening and welcome back, firstly. And before we went on break, we have talked quite about shingles, and we have literally touched many areas of shingles. We have talked, so if I don't mind asking you to give a quick recap.
Sure, of course. Well, we've been talking about how shingles is a painful skin rash that is caused by a virus, and that's the same virus as the chickenpox virus. And how you can get shingles is you don't catch it. It's having had chickenpox earlier in life, that virus stays in your body asleep, and it can wake up later in life when your immune system isn't working as well. So it's particularly more common in people who are over 70, and it's also more serious in people over 70. It tends to have more complications and to be more painful and to go on to cause a long-lasting painful condition. So it's very common. About 1 in 4, 1 in 5 people who have had will have an episode of shingles at some point in their life, and unfortunately some people have it more often than once. It can be serious. Most people, thankfully, it settles down on its own, but in some people it can cause this long-lasting pain syndrome. A small proportion of people are admitted to hospital because of it as well every year. But it's very common. There's more in that high-risk age group over 70, there's more than 50,000 people who get shingles every year. So it's very likely that you might know someone who's had shingles, even if you haven't had it yourself. There's a vaccine available for it. It's been nationally available for the past 7 years, and that's available for people who are aged 70 to 79. And that vaccine substantially reduces the risk of developing shingles. And even if you do get shingles, unfortunately, after having had the vaccine, it's less likely. It's likely to be milder and to not last as long as well. So there are benefits there as well. It's an injection. Like most vaccines, you get it in your upper arm, and you only need to have it once, which is something I didn't mention before, actually. It's not like the flu jab, which you need to come back for every year.
Because that's something which I do wanted to ask you. Is it something which we need to have every single year or something, especially?
No. So I think it's something that you only have to have once. It's a one-off vaccination.
In the life?
Yes, that's right.
So once in a life?
Yeah.
Oh, that's good.
So it's good from that point of view. Some people, you might want to have it at the same time they go for their flu jab because it ties in quite well together, and you can have them at the same time. But actually, you don't need to have it with your flu jab. You can have it at any time throughout the year, and then you just have it once. You don't need to keep coming back.
Okay. I just have my screens pop up with questions from left, right, and center, which is really, really good. Okay, let's ask the very first question which popped on the screen. It says, how common is shingles?
Well, it is common. So as I said earlier, most people will have had chickenpox by the time that they reach adulthood. So most people have that virus in their body when they're an adult, and about 1 in 5 people will then go on to get shingles at some point during their life. So that translates to tens of thousands of people getting shingles every year throughout the country. More than 50,000 people in England and Wales as a whole will get shingles on a yearly basis. About 14,000 people a year get this long-lasting pain, this post-herpetic neuralgia, this ongoing pain syndrome every year. And we get about 1,500 people going into hospital every year because of shingles.
Wow.
Yeah.
Ouch. Okay. One of the other questions from a different listener says, are they contagious?
So shingles is shingles isn't something that you catch from someone else. So if you go and see somebody with shingles, you won't then get shingles. You're only at risk from someone with shingles if you've never had chickenpox or shingles at all, which isn't that many people by the time we get to adulthood. It's quite rare. But shingles is infectious to other people.
Okay. One of the next question says, what inspired the lovely doctor to move to public health?
Well, I think, so having worked in hospital medicine, I think it's brilliant to be able to have that contact with patients, and I really enjoyed that, seeing people and helping them on a daily basis. But I wanted to be able to work a bit more upstream to try and prevent people from becoming ill, which is what public health is all about. So it's trying to prevent illness, trying to protect and promote health before we get to that situation where we're in the hospital doing the treatment. So I think that was kind of why I wanted to move into public health.
Okay. The next question, sorry, the literally questions are popping up on my screen, so I said, okay, let me ask you, which is really nice because our listeners are listening to us. How can shingles be identified?
So shingles is generally diagnosed clinically, so that will be by going to see a healthcare professional if you suspect that you have shingles, and they should be able to diagnose you based on examining you, looking at the rash.
Okay, and in terms of, are there any, hang on a second, yes, this is the next one, yeah. Are there any communities that more likely to get shingles?
So the main risk factor for getting shingles is age. So in the UK, having been exposed to chicken pox is just really common. Almost everyone has been by the time they become an adult. So there's no particular communities. The main risk is being older than 75, and also people who have conditions that will suppress their immune system. So if you're on some cancer drugs, for instance, if you have some certain cancers or certain immune deficiency conditions, that will make you more at risk from shingles.
The next question popped on the screen, says, why shingle happens?
Well, I mean, unfortunately, it's because there's this virus that's so common in our country that, it causes chickenpox. Almost everyone is exposed to that, and then it stays in our body, and then we can get shingles later in life. Okay,
and what necessary care should we take while we are having shingles?
So I think if you suspect you have shingles, as we said before, speak to your GP or give 111 a ring to get some advice. You might be able to benefit from antiviral treatment if it started soon enough. Otherwise, at home, keep hydrated, take painkillers as you need them, loose-fitting clothing, keep it dry, the rash dry, to try and avoid infection. Don't use any antibacterial cream because that can make the rash worse.
Really?
Yeah. And those cool compresses we were talking about to just try and relieve them.
So things like some moisturizers and creams which can moisturize that area, we should not do that. We should not apply those.
It's advisable to try and keep it clean and dry, the area. So anything that might make it wet and more likely to become infected is probably not a good idea.
Okay. So in terms of chickenpox itself, now people who never had chickenpox,
yes,
like there are some kids at the age of 5, 10, 8, 3, around this lineage, never had chickenpox. So can they have shingles?
No, so you can't have shingles until you've had chickenpox, because basically the two terms are two different types of presentation of the same virus. So you have the chickenpox first, and then you have the shingles. And because shingles is that waking up of that virus in a particular nerve that supplies a particular bit of skin from your body, and that's why you get the rash only in one area, whereas in chickenpox it tends to be all across the body.
Okay.
Yeah. What I would say, though, is that some people will only recognise they have shingles and won't realise they had chickenpox because either they had it when they were so young they don't remember, or actually some people have chickenpox very, very mildly and don't even recognise that they have chickenpox.
Really?
Yeah.
Like, for example?
So just having had a very kind of mild general illness, minimal sort of rash. Most people have a more obvious illness, but
exactly. I had more than one time.
Yeah.
So I have chickenpox like twice or 3 times because I remember twice on myself, definitely.
Yeah.
And it was an extremely painful experience. I would say. That whole week was pain from hell, I must say.
Yeah, and I think that's what people say about shingles as well. It's very painful and itchy as well.
Okay.
Yeah.
So, okay. Okay. Here it says, how long shingles takes to be treated?
Well, I think it's difficult to answer because I think shingles can really vary from person to person in terms of how long it takes. So some people will have... So most people, when they just have shingles, they'll have that rash that's quite bad with the blisters for about a week to 10 days. But the rash will take about up to a month to clear up completely. And some people will have pain lasting longer than that, maybe up to a couple of months. But this is all can vary from person to person. Having the treatment does tend to shorten the illness, but it's quite difficult to put a figure on sort of how quickly it would clear up because it does vary between different people.
All right. Okay. So when like for example, the community, one of the questions says that if there are any specific communities, because there are Asian communities quite a lot, and they have less symptoms as compared to the non-Asian ones. So is there any proof for any things which is like certain communities are very prone to have shingles as compared to others?
No, not that I'm aware of. I think that it really... anyone who's had chickenpox can have shingles. And apart from, being older and having certain conditions that make your immune system not work as well, those are really the main things that make you more likely to get shingles.
Okay. A few more questions. I must say I'm really excited. Alhamdulillah, the questions are flowing through really nicely. One of the questions says, is there any other skin conditions which can be mistaken with shingles?
I think that shingles is quite distinctive in the way that it presents on the skin, in the fact that it's just on one side of the body, which is quite unusual. Otherwise, if it's not related to your nerves, to have something that's so clearly sort of marked out on one side of the body, and it tends to be sort of in a band around the chest or the tummy. And
so it's front side of the tummy?
So it will go from the middle of your body. It will go round to the back to the middle as well. And that's because the skin on your chest and on your back is supplied by nerves in kind of ring-like bands. And when that virus wakes up, it wakes up in a particular nerve, so it will just affect the skin supplied by that nerve, so it will be in a particular band on one side of the body, and it will also have those quite distinctive blisters, so from that point of view it is quite distinctive.
Okay. Okay. Oh, one more. Okay. Is there any specific food routine which a patient should have while shingles should... Oh, is there any specific food routines which a patient having shingles should follow?
No, I think just keeping your appetite up if you can, keeping well hydrated, eating healthily, all of the usual kind of healthy foods, but nothing in particular for shingles.
Okay. Wow. Okay. Oh, that's all for our rapid fire. It was like questions pouring from left, right, and center, which is really nice. Alhamdulillah. Thank you so much, listeners, for sending those questions. Because without your interaction, it's really hard to know that you are listening to us. And these interactions do help us a lot as well in many different ways. Because I never thought about food routines. I never thought about anything else to ask you. And yes, these are something which we have either gone through with some of our loved ones or maybe ourselves. So it is one of those things. One more question popped up from a different person. It says, can a person having shingles share bed?
Well, with shingles, you really don't need to worry too much unless you're going to be in contact with someone who's never had chickenpox or shingles, because as long as you've had chickenpox, you have already got that virus in your body. You've already got a certain amount of immunity to it. You can't sort of get it again, if you see what I mean. The only time you kind of need to worry is when you're with vulnerable groups who might be at very high risk of getting a chickenpox infection or of having severe consequences. So that would be pregnant women, newborn babies, or people with compromised immune systems. So if you have a family, or you'd be sharing a bed with someone who falls into that category, it's probably worth getting some advice from your GP about that. So that would be the instance in which I might worry a bit more about that.
I remember you mentioned about the if you can only have vaccine once in your lifetime.
Yeah.
Okay. So a person who had chicken pox and had shingles, had vaccine then and then have shingles again.
Yeah.
So what that person should do. So that means, and if somebody already had shingles vaccine and had shingles, will that be something they can do? Anything else, or all they have to do is just wait, watch, and take some paracetamol?
Yeah, I mean, unfortunately, the vaccine is not 100%. It's not a guarantee you won't get shingles. So you might have the vaccine, you might still get shingles, although the important thing in that circumstance is that there is evidence that shingles after having had the vaccine is likely to be milder and last less time. But unfortunately, that's just the case. Some people who've had the vaccine will still get shingles, and they just have to
bear the consequences.
Yeah, and do what we were talking about previously. Call up your GP if you think you've got shingles. Talk about treatment. Keep yourself well at home if you can.
Okay. I have a few comments as well. Brilliant, Fahad. The lady is very clear and quite informative. Thank you so much. Thank you so much, brother, for the lovely comment. So, in terms of the side effects, as you have mentioned earlier, so is there anyone who shouldn't have these vaccines?
Yeah, so most people can have this vaccine. So the vast majority of people, it will be fine. There are a couple of groups who can't have the vaccine. That's people who have a weakened immune system, and that might be because they have a condition that's made their immune system weaker, such as cancer or other conditions, or it might be that they're taking some medicines that weaken their immune system. The best person to speak to would be your GP to check if you can have that vaccination or not, and they can advise on that. The other group that can't have the vaccine is anyone who's had a severe allergic reaction to any of the ingredients in the vaccine or to the chickenpox vaccine before. And again, if you're concerned about that, that's something your GP can advise on and can talk through the ingredients with you, or your practice nurse. The vaccine does contain pork gelatin, and that obviously poses a problem for some people. And what I would say in that case is that it's up to an individual to make a decision about vaccination, weighing up all of the pros and the cons that we've discussed, and to come to a decision for themselves, knowing all of that information.
Okay. The comment which is brilliant show, and the lady is quite clear and informative, is from one of our brother Ishaq Qazi, and thank you so much, brother, for a lovely comment. I have a few more questions popped on the screen. Is there any age group of for shingles appear or happen, and some age groups are not?
So it's much more common in people who are over 70, and it becomes more common as you get older. But it can occur in anyone who's had chickenpox before. So it can occur in any age group. It's just a lot more common in older people.
Okay. Is shingle vaccine free on NHS? Sorry, that's one of the questions pop on my screen. Is shingle vaccine free on NHS? I've seen advertised privately.
So yes, it is free on the NHS for if you're eligible for it, and that is people aged 70 to 79. If you're not in that age group, you wouldn't be able to get it on the NHS, but you can get it privately if you're over 50. Because it's only licensed for people over 50. It's not licensed in younger people. But obviously that would incur some cost if you went privately. Okay.
I must say thank you so much. So we are almost approaching towards end of our show. And I must say that the time has passed really, really quickly. Yeah. So before we end, just for our listeners who joined us late, can you please give us an introduction about yourself, and then give us a brief introduction about the brief overview about the topic and a positive message, please.
Sure. So my name is Harriet Edmondson. I'm a public health registrar working with Public Health England.
So you're a doctor as well?
Yes, I am. Working with Public Health England and NHS England on screening and immunisation. We've been talking about shingles, which is a common disease that for most people causes a painful itchy rash that can interfere with their day-to-day life for the few weeks that it might be affecting them. But in some people it can cause long-lasting pain and complications, and that is it is as a whole more common in older people over 70, and they tend to also have a more severe version of the illness. There is a vaccine available for people aged 70 to 79 in our area from your GP surgery, and you can get that at any time. It significantly reduces the risk of having the disease and reduces the severity in people that still get it, and it cannot cause shingles in healthy people. So what I would say is that if you want some more information about it, have a chat with your GP or practice nurse, or have a look on the NHS Choices website on shingles. There's a lot of useful information on there. In general, having your routine shingles vaccination is a good way of looking after your health, so you can get on with your life, enjoying your life without having to worry about the pain of shingles.
Okay. Wow. I must say thank you so much, Doc, for coming to our show, and thank you so much for explaining about shingles. There are so many people who never knew about it, and they now know about it. To be honest, there are so many things which I do not know about this regarding shingles, because I've heard so many things about shingles, and I've seen some of my loved ones go through shingles. So thank you so much for coming to our show, and thank you so much for giving us your valuable time.
Of course, thank you very much for having me.
And definitely, it's the first time, but not the last time. We will be seeing you again in the future.
Hope
as well.
so.
That's all for our show tonight, guys. If you missed any part of our show tonight, or if you missed any part of our show, please catch us. We are back again. You can catch us on repeat on Sunday in the afternoon at 12 o'clock or 1 o'clock, or you can view us on Facebook as well. That's all for me tonight. Please do remember us in your duas, and definitely we all need your duas. And next week there will be no show. There will be live charity bill. So until next time, I'm your host Fahad Matin saying Assalamu alaikum. Assalamu alaikum.
Thank you for listening to our podcast. We stream our daily broadcast on inspirefm.org. You'll find all our daily updates on our social media at Inspire FM Luton.